Welcome, everybody. Thank you so much for coming today. Glad to have you here. My name is Elizabeth Rowland. I'm Executive Director at Tennessee China Network. For those of you that don't know about Tennessee China Network, we are a 501c3 nonprofit organization, and our mission is to educate and connect people in Tennessee that do business with China. We are so glad to be here at the Vanderbilt University Owen Graduate School of Management. And thank you to our dean here for being with us and for allowing us to have the event here today. I want to make a few little remarks, and then I'll let you make some remarks, and then we'll kick it off to Dr. Friedman. So first of all, I want to have everyone take out these little devices. And you know the off switch. Let's turn them to silence so that we don't have anything coming out in the middle of the event. I want to, besides thanking Vanderbilt University, also thank our sponsor for the event, Implement Now, and our panelists and our volunteers as well. We couldn't do this without you all, so thank you. We are going to be recording this event on a Zoom webcast. So as we proceed, if all the panelists and audience members, when you ask questions, if you can make sure to speak slowly and clearly so that the people on Zoom can understand the words coming out of your mouth. They can also, you all during the question and answer period, can ask questions just by raising your hand. The folks on Zoom can text me your questions to my cell phone. That is 865-387-7012. The last thing I want to say is if you all, there's surveys on your tables in front of you. As we're going through, feel free to fill them out. And at the end, just leave them there and we'll come around and collect them. Those surveys help us improve our event each time. So thank you for giving us feedback. All right, that's enough for me, and I will pass the mic to you for a few words. Yeah. Thank you so much.
Thank you. Well, we're so excited to co-sponsor this with you and have you here today. I'm Eric Johnson, the dean here at the Owen School, and certainly this topic is one that's super relevant for us and things that we were thinking about here at the school, and even at a very kind of personal level. When we think about our businesses, I run a business here called the Business School. And a week ago, I had 700 of my colleagues here from all over the world, business school deans from all over the world. The number one topic was the impact that this is going to potentially have on our schools next year. So many of our schools have significant numbers of Chinese students, and there's great concern about those students' ability to get their visas processed in time to start school in the fall. And that is a huge business issue for us. So I'm excited about this panel, and I'm really grateful for Professor Friedman, who really leads our Asia-focused efforts here at the school, and particularly in studying China, and his ability to put together just an amazing panel. So welcome and thank you.
All right, good evening, everybody. I want to thank Elizabeth for being really the one spearheading most of this. So this was her idea, and I kind of helped support her to make this happen. We have a very experienced and knowledgeable panel. If you wanted to learn about what's going on in business with the coronavirus, these are the folks you want to find out about. The way we're going to work is I'll introduce all of them in just a second, and then we'll have each of them give about 5 to 8 minutes of conversation, hopefully about 5, and then have one question initially for each speaker. And then we'll have lots of time, I think, for a broad set of questions. But let me go ahead and launch into the introductions. So Dr. Mark Denison is the professor of Pediatrics, Microbiology, and Immunology at Vanderbilt University Medical Center. He's one of the world's leading experts on the coronavirus. He's been seen in the New York Times, both now and back when he was covered a lot for the SARS epidemic. so he can talk about it from the biology point of view. We'll have visiting us via Zoom from Shanghai, Nicholas Smith, who's the general manager of the Shangri-La in West Shanghai. He has been the general manager for the Kerry Hotel in Hong Kong, educated in the UK, and you can see a little bit of his face up there, but we'll project him when it's his time to speak. Jerry Goldenson, president of KHS America. That's a maker of musical instruments. It is based in Taiwan and sources a lot from China, including guitars, flutes, drums. Ken Strait, VP of Product Development and Sourcing, Tractor Supply Company. Extensive retail for farms, camping, tools, home and garden, headquartered here in Greater Nashville. And then Jing Henrie, did I pronounce that correct? VP of Product Development and Sourcing for Implement Now, who's our sponsor. Implement Now focuses on the manufacturing and supply chain. Jing is a global sourcing manager, was previously for Target, and now working for Implement Now. Heather Couch, also working for Implement Now, Product Development and Sourcing Manager, previously with KHS, so it's all in the family, and lived for many years in China. And lastly, Dr. Mary Margaret Phil, who's a medical epidemiologist with the Tennessee Department of Health, Communicable and Environmental Diseases and Emergency Preparedness. And so we'll end up with a view of how this might be playing out in terms of local Tennessee health issues. So I'll be the moderator. I might be popping behind here to deal with some of the Zoom issues. But I'd like to start off with Dr. Denison, and I'll hand out a microphone. Here we go. Welcome, Mark.
Thank you, Ray. I'm honored to be here. I am not qualified in any way, except that I have been working with coronaviruses since 1984. Long before when they were just known as cold viruses in humans and mild cold viruses at that. With the long-term predictions that we had made a long time ago, working with some of the animal viruses in tissue culture, showing that they could move between different species of cells and that they could really serve as generalists to infect different populations. Our work then has been focused, certainly since the SARS epidemic and the recognition that this could happen in human populations, on trying to understand how they replicate, how they move between virus species, how they cause disease, and then the ways that we can potentially interfere with those, which we call countermeasures, which is vaccines, antivirals, antibodies, and other ways that we can try to treat coronavirus disease. That's work that we've been doing for the last 6 years, or to 8 years. The drug is being tested in China for Decibir right now. That was tested, it's a Gilead drug, but all of the work, the testing of that was done in our laboratory. And so the publications that based on testing of that in China was based on the work in our lab. The work by the people in my lab. They don't let me do that work. So that's tested against SARS and MERS, and now we're going to be testing that against the new coronavirus. It's, I think, just since I have a very short period of time for Ray, is never give a scientist just a few minutes. It doesn't work well. When you ask them about their work, they've been doing it for 30 years, but I will just make a few comments. One is that I think the data that suggests that this is what I would call a generalist virus. It's likely, very, very likely a bad virus. It's, I think other things you would hear about snakes and other things, I would just say no to that sort of categorically. This is likely a bad virus. It probably was sort of fully formed and ready to infect humans under the right circumstances of interaction with humans. And it's now a human virus. That's called zoonotic, moving from an animal to humans. It has the capacity for what we're seeing. And what are the things that make it, I think, certainly interesting biologically, but very concerning from a public health and social perspective, are this issue of its capacity for causing infections that aren't as severe as SARS. So SARS, for those of you that are young, old enough to remember that, was really a disease that principally was transmitted by people who were acutely ill. You had to be seriously ill at the peak of infection, usually with a bad respiratory infection, to transmit the virus. And it didn't transmit before that, and it didn't transmit after that. That made it really easily controllable by public health measures, by isolation and quarantine. This virus appears to have the capacity to spread pre-symptomatically, I'll call that, right, before someone is acutely ill. And that's being batted back and forth, but I think the evidence is substantially clear that this virus has that capacity. And so that makes it much more difficult to control and isolate by those measures. can't speak to any of the, I can only speak to the biology of that. Is this virus mutating and changing? I don't think there's a lot of evidence it is. It looks like it's capable of causing this disease without that. That's a good and a bad thing. That means it doesn't need to change substantially to spread. The good news about that is it really doesn't appear that it's broadly changing to cause the nature of the disease. So if it's controlled, it will be controllable. Are there compounds and what's the nature of antibiotics and vaccines? Vaccines are going to take time. They never can be done faster than 6 to 9 months. This will be the fastest in human history to develop a new vaccine. And that's likely to occur, but there'll be something that will be useful. Antivirals, such as we're testing, which are drugs that would directly treat the virus, are likely maybe available now. There's one fascinating one that's been tested in China, which is chloroquine, which is an anti-malarial drug, which is broadly available. If it works, that would be great because it's widely available, it's cheap, and it could be widely distributed and is known to have a safety profile. So I am happy to answer any questions, and I'll stop because I could riff on lots of different topics. But I think this virus and the concerns are the nature of the spread among humans.
And let's have any questions. We'll take one question. Any questions about biology or the science of this? Yeah.
So the root origin of the virus, we have an exact, because I know it's gone back and forth a little bit, where it came from.
I'll repeat the question. The origin of the virus, do we know? No, we don't. But when we look at the genetic alignment of it with other things, there's like 1,200 bat species. Okay, bats are about 25% of mammalian species. Most bats that have been looked at in different populations in hibernacula, the bat places, are shedding 6 or 7 coronaviruses asymptomatically. It's a huge pool of opportunity. The probability of finding this exact virus in a bat is probably low. Is it necessary? No. How did it get into humans? There's many ways it could have. One would have been a direct humans interacting in a bat in a cave or somewhere like in someone, because this doesn't cause acute severe illness. If they were mildly infected, they came back into the market or to an environment. Another opportunity is that bats were in a presence where there were multiple wildlife animals, and the bat cage was on top of a civet cage, on top of a pangolin cage, on top of something else, that there's an opportunity for transmission, very, very close interaction and interaction with humans and materials that would potentially spread the infection. That was the probability with SARS. That's a reasonable hypothesis for how this got into humans. Once it was established, it looks like it didn't need to make a lot of changes and therefore could be spread out from the markets or different areas into human populations.
Thank you very much. Next, we come on to Jerry.
Well, I'm also very honored to be here. I'd like to really defer my time to you.
Me too.
Much more interesting. Anything I could possibly have to say.
My wife might differ.
Yes, we're probably never going to say. So I'm president of KHS America, and we're a global company based out of Taiwan, and have manufacturing facilities all over the world, but a large part of our manufacturing is done in several facilities in TNCN. We make musical instruments. We own 20 various brands of instruments. And there's a lot that goes into making instruments, so they have very long lead times. So something that impacts us like this, and delays production, shuts down factories. We saw some of this early on when we had the environmental shutdowns about 1.5 years ago or so. And then, of course, it wasn't a shutdown, but we had some other impact with tariffs and so forth. And now this. So all things that affect our business greatly. And even if we can keep it within a short term, it's going to have some long-term effects because of delivery issues. Our particular industry is very seasonal. A lot of it's built around school education. So band and orchestral instruments, the highest point for band and orchestral instruments is having available product in August for the start of the school year in September. So working within the timelines, even a month delay can push it past the time we would need for availability. We've been relatively fortunate because as we predicted the tariff impact, we loaded in a great deal of inventory before September of last year. So it served us well, certainly in the fourth quarter, but it's going to help us a little bit in the beginning of this as we wait for our factories to be open. Our factories are not open yet. We're trying to source medical supplies that the government has told us we need for our factory workers. We have around 2,500 workers. So trying to supply a medical mask, let's say, of a specific specification, one per employee, one each day. So as you can imagine, certainly is a lot of masks. And anybody that will tell you that they're in very short supply, and I even try to call in favors to friends at Health Trust and HCA. And unfortunately, there's a worldwide shortage, so it's making it very difficult. So even though things are seemingly calming down, we know that ports are opening up, so factories are able to open up, but the guidelines to open are restricted by some of the other things that we can't supply because they're in short supply. 80% of the world's mask production are approximately 200 meters from Wuhan. They're not doing it, right? Nobody has any. So we're working diligently with our factory workers and our team in Taiwan to try to see how we can get back to some sort of normalcy. We have a very strong plan. We're trying to stay very positive, but there's no question it will have impact. Not just once we open, but things like smaller manufacturers with parts supplies and so forth. Having talked to other people in our industry, in the musical instrument industry, even U.S. manufacturers use a lot of Chinese-made parts. So all of us are kind of in that same boat, where everyone's scrambling to try to figure it out. We'll be very fortunate because of the size of the company that will hopefully be able to get up and running very shortly. But we do see some significant impact and delays to some of the seasonality of the biggest portion of our business, which has been orchestral instruments. So, any questions?
Yeah, over here.
A question about supply chain strategy, and this may apply to many of you. At the presence of these disruption risks, this kind of virus, the trade issues, is that leading you over time to broaden out your supply chains and not be concentrated in just one place here and there? And are you long term going to have to look at a different model than just the way that you make it work, where disruption risks seem to interfere?
Let's just repeat that for the Zoom audience. They may not have heard that.
So the question lies in strategies for, let's say, diversifying your logistics or manufacturing, correct?
Yes.
So I can answer that, at least as it pertains to us. We do have a lot of facilities all over the world, but each facility manufactures specific products, and typically it has to do with either the labor force, the skill set, or the available market. So China, for us, is a very large market, so it's very easy for us to make products in China. It's not just about labor rates or cost of manufacturing. It's because it's very easy to manufacture and distribute into the China market. But we are looking to see how we can expand our facilities in Taiwan and other regions to try to make sure that we offset potential risk to be able to do that. Yes, it's something we've been looking at now for probably a couple of years for various reasons. But right now, our facility is a good part of our business, and we're able to weather these storms at the moment. But eventually, hopefully, we'll be able to diversify enough to be able to be a little more proactive.
Thank you. Well, having heard some discussion of the employees in China, I'll move now to Nicholas Smith, who we're going to try and make sure who tested this and it worked before. So let me come on over here. And so Nick, if you could open up your audio.
Morning, everyone. Can you hear me?
trying to make this bigger. Hold on a second so I can make this bigger. There we go. Okay, Nicholas.
Well, morning, everyone. It's a beautiful sunny day here in Shanghai. Business is not quite what it was supposed to be, and that started back at around the 24th or the 25th of January. A lot of you that are in production or know the supply chain know that it was going to be Chinese New Year anyway, and business was going to be ramping down. And then normally second week of February, we would have been kicking back into a very busy time, picking up on orders, picking up on a lot of guests coming in and out of the hotel. And the forecast for the first quarter of the year was very, very positive, even up on last year and the year before. Unfortunately, that business dropped away very, very quickly as soon as the outbreak became very serious. And the number one focus for us was the health and well-being of all of the people that work in the organization at this hotel and our other hotels in Shanghai. Number one, to get them protected. And as you mentioned, we all have to wear one of these pretty much every hour of the day unless we're in a personal space. So masks are a premium product. Business itself, the demand dropped away within 3 days. As a hotel of 508 bedrooms, we went from being approximately 85 to 90% occupied to 3% occupied. We have all of the food and beverage operation closed. All of our corporate business has canceled through until March. And our banqueting business has also postponed to later in the year. Shanghai, having lived here on and off for 8 years, could only be described as a very, very eerie place for a few weeks at the beginning of February. Very little traffic on the streets, both pedestrian and vehicle. And now, slowly but surely, you start to see a lot more signs of life. Rush hour this week has certainly got a little busier, but unfortunately, the business demand, we are attached to a shopping mall. We're attached to 42 other food and beverage operations within that shopping mall, and pretty much every one of them is closed. So if you can imagine going to your local shopping mall on a Saturday morning and throwing a tennis ball and probably not touching one person. So it's very, very, very quiet. The good thing is that people now have a very clear understanding of what they need to do. The 14-day quarantine rule is in place. If you've been anywhere outside of Shanghai, you need to conduct that either in a private premises or at home. And your temperature is taken once a day and you have to report that. Technology being so advanced here in China that they've managed to do a lot of that via app and via other forms on WeChat platforms, which is very, very useful. And now people are beginning to look towards the future. Recovery, frankly, is probably looking at, I would imagine, the end of March, beginning of April at the earliest. All the exhibitions and all public events have been cancelled or postponed. 70 exhibitions from January through to April in Shanghai themselves have been postponed to later in the year. And really business is kind of on pause as everybody gets themselves back into a safe place, gets quarantined, and then is slowly be able to reintegrate back into the working life. My estimate is, with the office towers around us and with the hotel, that we will start seeing normal signs of life sometime in April. Some good news from the sourcing markets is that the EU sourcing market, which is a very famous place for many sourcing organizations, has reopened, and they've done a fantastic job of that. And I really think it's important to mention how the authorities have handled this very, very diligently here. in the city. There is no stone unturned, and people are very, very serious about it, but they're also banding together, and you can feel that the nation are very much keen to put this behind them and work forward and make business their priority for the rest of the year. That's it. Any questions?
Let's see if any questions from the audience. Yes.
One question. You know, Shangri-La is a large multinational, lots of support from your corporate organization. What kind of impact do you see for the smaller local hotels and people in your industry that don't have that global network of mutual support, if you will, that are independents or semi-independent?
I know that there are two answers to that question. Obviously, there are a number of businesses that remain closed and they have to look after their employees, and the government have promoted that look after your people first, worry about the business a little bit later. There is no doubt that there are going to be some businesses, I would imagine, that would be affected by the fact that they've had absolutely no cash flow for the last, 4 weeks. There are a number of measures that have been put in place by the government already. Tax breaks, social insurance payments, allowances and such like, and they've all been fast-tracked very quickly. So I think that there's a lot of support coming, for all business owners, and even local communities are offering grants for training and keeping people. The online training platforms have exploded very, very quickly. Not only on the educational side of things for the children and not back to school, but also on the workforce. So I think there's certainly a focus on that, but the harsh reality is that there is going to be some fallout from the fact that there just hasn't been any business. The one business that has boomed is the delivery business. These guys are running all over the city, and you see a large number of new employees coming on very quickly. I notice it in the shopping mall with the 2 or 3 shops that are doing delivery food, that you see 2 or 3 new delivery drivers nearly every day because they just have such a huge demand for delivery into their area. So some people are surviving on that business model instead, if they're able to move quickly. And that is quite possible here in China, because the delivery model, Alamar and Meituan, who are 2 very big delivery companies, have been operating at a very high capacity over the last 3 weeks.
Thank you, Nick. Well, now let's move to Mr. Strait, so VP of Product Development and Sourcing, Tractor Supply Company.
Hi, I'm also honored to be here. I'm learning lots as I sit here. The Tractor Supply is a rural farm and ranch set of stores and e-commerce site. We have about 1,800 stores. We also own a small business called PetSense, about 180 stores of rural-focused pet products. And we do probably about half of our products are made outside the United States, about half of them inside the United States. And we focus a lot of what we make on animals, pets, and things that people need for their farm and ranch. So that's kind of position where we are. My group does product development for the 18 brands that we have that are our exclusive brands. And the sourcing for those, plus some other Q items that may or may not be branded. A lot of that is in the United States and a lot of it's overseas. So I was thinking about when this started, I took a look the other day about what I sent out to my people, and I am old enough to remember SARS. Back when SARS happened, I had a person in Hong Kong that ended up quarantined there for 3 months. He was opening an office for us over there. So I think part of that time he needed to be there to get the office open, but it was, you're not traveling. So I do remember that. But when I first heard about this I sent a note out to my group on, what was that, January 23rd, I think it was. And said, look, cancel all the travel, plan to Skype it, plan to work from here. And just, this is going to be affecting us. At the time, I think there were 26 deaths already. So that was, so I expect this to go for a while. We're kind of lucky in that most of our 200 factories we're dealing with over there are not in the Wuhan area or close by there. So we're getting a lot of products out now, and expect good, but it's going to be a while, and it's going to be like I liken it to a snake having eaten a gopher. You're going to see this movement all through the snake as it digests it, and it starts with the factories and getting the workers back, and then trying to get containers, and then trying to get drivers, and then trying to get into the port, and then trying to get on a ship, then trying to get in the ports of the United States. We're going to see none of it's a problem right now in terms of getting it to the port or getting it on a ship, but we're going to see it start to bottleneck here in the next week, 2 weeks, 3 weeks as all the factories get up and running. Most of our factories are up running, probably on the average about 70% of the people up and moving, and they're starting to get through this whole can't cross the borders. They're starting to authorize some of the drivers. So the biggest fear I had was, if the province doesn't have a port, how are you going to get it out if you're not crossing borders? So they're starting to figure that one out. I think it's been an interesting time. But in the meantime, I'd like to hear more from Mark than from me. So I'll pass this on.
Any questions for Ken? All right, let's move to Mr. Henrie. What was the question? Oh, yeah.
I'm curious, as a consumer-facing business, like, did you kind of have a conversation with the companies, like how you would talk to consumers if this impacted them, and if you would kind of publicize that, or if you wouldn't say anything? Like, did you guys talk about that at all?
You know, we really didn't expect it to come up, but it really hasn't with the consumers. We've got a really good person's in charge of consumer and investor relations, and Mary Wynn's been on top of what's going on and informed. But it really, our customers aren't thinking of it the way we run our stores. But even though it's 1,800 stores and we open about 80 a year, in each market they're in, they're like a hometown store. So I think for the most part, our customers aren't really tying us to the virus. And the reality is, in comparison to most companies, we have a lot more product that's domestic. So even the things that are imported, a lot of them are imported just from Mexico or Canada. So it's not as big an effect for us as most companies. But yeah, we haven't had any kind of address to that I know of. Now Mary Wynn may have, I don't know.
Now we have two speakers from Implement Now. So first, Mr. Henrie.
A little bit about Implement Now. We're a lot different. We represent a lot of brands in helping them get things manufactured, whether it be here domestically or overseas. And we represent anywhere from, depending on the time of the year, anywhere from 40 brands to 100 brands. And so we deal with a gamut of different types of products, from apparel all the way to hard goods to stationery, just across the board. We're helping a lot of different companies and organizations get things manufactured. It's been really interesting. I've been focusing so much in the last year, how do I get myself out of China so fast, to alleviate myself of having to work with tariffs and deal with tariffs, because most of our clients are very cost sensitive, and managing tariffs, sometimes it's a tough pill for them to swallow. And now I find myself today going, how do I get China up and running again? And it's such a fluid process, because every day, I think when I walk into the office, it's very different. And I have to spend a lot of my time trying to peel back the rumors, you hear a lot of things, because if it's on the internet, it's true, right? But you really have to make sure you're spending the time to figure out, when you peel back all that stuff, really what's happening to the people over there. And I think, and you're very fortunate to have 7% because we're right around 5 to 10% of our factories are really, that's where they're at capacity-wise right now. And we're spending probably a lot every day, if you talk about being consumer-facing, we spend a lot of time with our clients telling them, okay, this is what we know today. It's going to be different tomorrow. And that's really, really challenging as we deal with that. In terms of the supply chain, it's going to have a deep impact that we're predicting from our end of things. I spoke to a couple of our supply chain partners because we deal with a lot of different ones. They're telling us right now, once goods get moving in, it's a 3 to 6 week delay at port. That's what the bottleneck is going to look like. So once it hits the port in its container, you're looking at another 3 to 6 weeks. It's just going to sit there before they can even get booked onto a vessel. So if you can imagine what that's going to look like long term, think about the back to school season that we're coming up to. And think about all the notebooks and pens and rulers and everything. You have kids that you're thinking about that school list, how that's going to impact that. And it's going to impact that greatly because we don't know what the inventory levels are going to look like. We don't know how quickly they can replenish because it's always that mad rush for that. How long this lasts, I don't know. It's just really going to depend on how long China stays the way it is. And I know we have some really smart people working on keeping it controlled and make sure that we don't have a major outbreak here. But we spend our time really looking at how do we keep our clients up and running? How do we get going as quickly as possible? And just every day is just a fluid day, and we spend a lot of time just communicating with them, really giving them the news. It's a lot of just sitting on your hands and just kind of, okay, what does this plan look like today? What does our plan look like tomorrow? If they don't get up and running in 2 weeks, what are our other options that we have to do for our clients? And that's our kind of our day-to-day. Questions?
Question in the back.
Yeah, thank you for joining us. So it's curious, the way you phrase it, I enjoyed it. You said that you spent the last year trying to get out of China, the last month or so trying to get stuff started in China again. I'm curious, why, have you seen this with a lot of your clients being an accelerator to get out of China? Where people say, you know what, this is already a huge enough disruption. We don't even want to go back, or we were already on the fence about getting out. Let's just find somewhere else to do our manufacturing.
I think it really depends on the product category, because there are product categories that you can leave China with if you have the right quantities, the right units, that sort of thing. Right now, everybody talks about let's go to Vietnam, let's go to Bangladesh, let's go to India, and you hear a little bit of Pakistan as well, and you hear about that. But there are pros and cons to moving countries of production. You also have to think about, even if you do move countries of production, you have to think about those tier 2 and tier 3 suppliers. Where are they getting their components from? We have a lot of production that's outside of China, but guess what? Some of the components are coming from China. And so it's the same impact overall. In terms of, there are times when it just makes sense to stay in China. No matter what, if there's a 25% tariff, and if the tariff goes to 100%, then you start going, I need to think about that for a second. But it really depends on the product category, because you can say, yes, I'd like to move this item to whatever country, but do they have the capability to handle that kind of production? Do they have the expertise? And what China has done really well, and they've demonstrated this, is they can do a lot of different things and do them very, very well.
Good question, Daniel. Now Heather.
So I worked with Jing. I won't have that much to add other than I lived in China for 13 years. The first 2 years I lived in Wuhan. I was actually there during the SARS outbreak. So I was in one of the universities where we were quarantined at the time, but I was very young, so I thought it was pretty fun to run around the city when nobody was on the streets. I kind of am in the nitty-gritty where I'm talking to factories all over China every day on WeChat, morning, night. I'm the one talking to all the Chinese folks. Lots of friends in Wuhan, so I'm kind of getting my news from the Chinese, not from the American news stations. So yeah, it's interesting, and I'll agree with what Jean said. I wish we were at 70%, but I think by the end of February, they're talking about maybe being able to get to 20%. And our factories are telling us that they have to have 5 masks per day per worker, and it's simply not available. So I think Jean's already kind of covered what I would have covered. So if anyone has any questions.
Yeah.
just a kind of a follow-up question. Right now, a lot of people talk about move their supply chain to Southeast Asia, like Malaysia. Not only I would look at their law, actually, some of the countries have even strict law in China. So what about, during your course of business, what would be like top 3 or 5 issues or problems you are seeing for like manufacturing in the Southeast Asian countries, like Malaysia, Thai, Vietnam?
Well, I did live in Cambodia for 1 year, but I actually think Jing probably is going to have a much better, because of his past, will be able to answer this question better.
So the question is, what are the disadvantages, are you saying, or the challenges of moving countries of production?
Right. Or like manufacturing in those countries, what's the current problem?
You have to look at the kind of using a sourcing term, the total cost of ownership. Yes, sometimes the cost is a little bit higher. You don't have a tariff. Great, but you look at the lead time could be much longer. The tier 2 suppliers, components are coming from a different country because they can't produce that within their own country. You also look at the shipping times. For example, if you go to Vietnam, you're looking at 2 additional weeks just to get it shipped over here if you put it on a boat. So those are all things you have to take into consideration, and every single piece of it, you have to place a value on that in terms of, you put a monetary value on it, even though it's only a week. What is a week in the retail world? A whole lot. And it matters a lot. Sometimes that's the difference between putting it on the boat versus flying it over, right? And so you have to look at all that, and then you also have to look at some of the economic conditions within those countries in terms of how stable is the labor. For example, in Cambodia, the labor force there is very unstable. You can get great costing there, fantastic. You don't know day to day if those factories are going to stay open, remain open, if the workers are going to show up. So those are all different types of factors you have to take into consideration.
Thank you.
Now, Dr. Phil will bring this back to local, context. You're responsible for keeping us safe here in Tennessee.
Yeah, so
How are you going to do it?
So I get to share a little bit about the public health perspective to this ongoing epidemic. And I do think it's important, though, not just to look at Tennessee, but we really have, 3 layers of public health organizations and infrastructure around the world. So, globally, the public health organization is the World Health Organization. It's the public health arm of the United Nations. And they're tasked to work closely with countries all over the world on all kinds of health and disease issues. So not just communicable diseases, but chronic disease, injury, malnutrition, food instability, all those kinds of issues they help to tackle. So, globally, if we take a step back and look at the big picture, public health is largely responsible for a lot of the surveillance that happens for this disease. So really the bean counting, trying to figure out how many cases have been diagnosed around the world and in different communities. And so, looking at the global picture, we're sitting at slightly over 78,000 cases that have been diagnosed. The vast majority of those are still in mainland China, and the vast majority are in Hubei province in central China. We are starting to see a rising number of cases in Japan and the Republic of Korea and Singapore. And then I think in the global health community, there's a little concern that there's been a few cases identified in Iran as well. So, the World Health Organization has been monitoring the situation from early January on. Their team has visited China many times. They have a technical team that's visited, and I think some might still be in country now to work closely with the Chinese health authorities. They did declare a public health emergency of international concern on January 30th. And while I think to some that's probably semantics, it is notable. It's only the 6th time in history that it's happened. And while it doesn't bring any specific regulations or money with it, I do think it's really a call to action for the global community that states need to work together and collaborate, as this could be an issue that impacts many countries outside of Southeast Asia. So then if we look domestically at the federal level, the CDC, or the Centers for Disease Control and Prevention, are our primary public health agency in the United States. They have many hats that they wear in events like this. I think they have over 800 staff working on the novel coronavirus now. So some of the things that we look to them for from the state and local level is that they help us with surveillance definitions, so there's that case counting, making sure that we're all doing it in the same way. They help us develop guidance for if we do have a case or someone that we're concerned might be infected, how to approach interviewing them, tracing their contacts, restricting their movement, or isolating them from the public, those types of measures. They are a huge component of diagnostic capacity in the United States. So until recently, CDC was the only place where we could have testing done for the novel coronavirus in the US. We now have some state health department labs that have developed that capacity, and more are getting on board with that in the coming days and weeks. But for the first month, basically every specimen that was tested, I think over 600 have been tested in the US now. They all went to the CDC in Atlanta for testing. And then they work closely with Customs and Border Patrol and Homeland Security and others on border control and entry and quarantine measures and things like that. So they're really the point of contact agency for all those efforts. Incoming traveler screening, I think they've now screened over 40,000 incoming travelers from China and other places in Southeast Asia. Many of those are CDC staff that are full-time at airports, mainly 11 airports around the country doing that work. And so then in Tennessee, we have been following the situation closely since early January. We have a team of folks that has been working on this really most days, much of the time. Since then, we have activated our State Health Operations Center, and just to ensure that we have the maximal capacity and resources that we need should we have a case, which we do not have at this time. And really just a lot of close work and liaising with our metro and regional health departments across the state. So they are really the boots on the ground, skilled, tasked people who are talking to doctors and clinicians when they have patients that they think might need testing. They are the ones that would be doing contact tracing and interviews should we have a case in Tennessee. So developing guidance and resources for them has been a big part of our effort. So lots of communication to those groups. We've of course done communication just with the healthcare community at large. We've distributed, I think, 2 messages through our health alert network system that reaches about 18,000 licensed clinicians, hospitals, public health professionals around the state, just to make them aware of the situation and advise them, of course, to do traveler screening at all points of triage in the healthcare system. And then really we just try to be a resource for people in the community. We have a team of probably 6 to 8 folks that are fielding calls off and on throughout the day, from everyone from returning travelers themselves to clinicians to other interested parties that have questions about the situation and trying to determine what they need to do to keep themselves and their family and community safe. And so I think those are kind of the big buckets to keep in mind. I'm happy to answer questions that anyone has about specific work, but I think we have done a lot of work to be very proactive, and I think we're in about as good a place as we can be should we get a case in Tennessee to be able to respond appropriately.
Thank you. Okay, question? So is there somebody?
No, I'm not on Zoom yet. People on Zoom, you can ask questions. Please text me at 865-387-7012. And also, if you can't hear, please text me that as well so we can adjust any sound as necessary. And just one more public announcement. When people ask questions, if you don't mind saying your name and your company, or if you're a student, so that we can get to know each other a little better. My question, considering China's practice of controlling information, do you as a medical professional and in the state, and do you think also the CDC and WHO, if you can speak for them, feel like you're getting the information you need from China to effectively respond? And do you think the information that's coming out of China is a high level of quality?
I mean, it's hard for me to speak to that specifically. I'm not in the upper level echelons of CDC and the federal government that are having conversations with leadership at the World Health Organization and other places. I do think that compared to SARS, we've certainly seen a lot more transparency from the Chinese government. I think it's hard to walk a mile in someone else's shoes. And so have things been done exactly the way that maybe we would do things in the United States or things would be done in Western Europe? Probably not. But it is hard for me to judge that as someone that has never lived in that country or been a part of that system. That being said, I do think in the age of social media, of rapid science and research, I do think, and I'd be interested to know Dr. Denison's thoughts on this, I've been impressed at just the sheer number of scientific publications that have come out very quickly. We're seeing a lot of information in high-level scientific journals sharing everything from small-level sort of case series to, just last week, China CDC published a case series of over 45,000 cases of coronavirus describing the breakdown of symptoms, the demographic characteristics of patients, the clinical severity breakdown, a true epidemic curve, which is something that we're always very interested in public health, based on symptom onset date, not date of testing. And so, those efforts have clearly been a priority for the Chinese, and I think has been a way that they have been trying to communicate, information that has been vetted in peer-reviewed journals to at least some degree, and many of them with the rest of the world. And that has certainly been helpful. There's certainly more that we want to know, but I'm not sure how much of that we can really attribute to the fact that it's happening in China versus the fact that this is a novel and emerging pathogen, and it's just going to take time for us to do all the studies and get all of the questions answered that we need to.
Thank you to all the panelists. We've now everyone had a chance to talk. I mean, clearly it's an integrated medical, human, social, economic phenomena going on. And it's wonderful to hear all the different perspectives. So now I'll just open it up for questions to anyone or between the panelists as well. Or if anybody wants to react to what you've heard already on the panel.
Question back here.
Not a question, just a follow-up. I'm from China. Actually, I was Vanderbilt in 2006. I'm Chinese medical. My name is Jing. My name is Jing. Call me Jin, Jin. My training is Chinese medicine for 8 years, Western medicine for 7 years. That's PhD in physiology. Now I went back to integration Chinese medicine and Western medicine. I'm the first postdoc in China for OB/GYN. But 21 years ago, I came here in Kansas City to the development biology that part. 2006, Vanderbilt invited me in Center for Home Biology. 5-6 years of that, I really see the Western and the Eastern have to become together, merge together, and whole Chinese, what we learn, that's what we see our body function as organic whole. We're not only our cell body, also we are with the universe. That means the Western very good, a lot of things that, we under the antibiotic, the whole process that is really big contribution to the whole global. But we are focused on the anatomy driven. We really don't know how body functions in this part. That's my focus came here, but I didn't find solution. So I picked up a computer license. I started to search the most simple way of whatever the 6 years I really benefited, continue learn until today. And people watching all the time right now what's happening in China. Based on you just asked the question about transparency in China. That's absolutely. We first, even in Wuhan City, we haven't shut down yet. All the information already come to here. Because before we have collaboration with the US, we studied virus things. That's the SARS virus, the genome things. This we first have this the information. That's right now American. We have one antivirus. The drug is for Ebola. I think that one is right now like a clinical trial in China. And we haven't get any results yet. Maybe in April we can find that. But the thing is, it doesn't work. So many people so fast that progress. Then because that's target the lung very quickly. Yet we see the totally white lung. All the machinery tells us it didn't work that. It progressed to the place. There's so many deaths right now. But when we have Chinese medicine stepping in, things totally change. And it's actually can control. To stop people progress to the late stage, part. But Red also have just a paper published and shared in WeChat information. They searched the herbal medicine, they targeted over 900 sub-genes or things. This is, to me, first thing is work. You need to control this part, the how that works. I think university, just some people, they don't really reject this part. But from Chinese government authority, they mandate they have to take the herbal medicine. Now people are taking that, but we still the both east and western. I think it will be very quick, but it's based on the Chinese medicine, a lot of principles back in 2005 year. Even at school, I didn't learn a lot of things, truly value the things that we didn't learn. Now we miss that. Yeah, okay.
Thank you very much. Thank you for your contribution. Thank you. Did you have any questions also to the speakers?
I want to know one thing, how we, our procedure, but if we have some exposure here for this breakout, how we, our strategy to handle this. Just if, I think right now we don't have here.
Yeah, so you know, right now in the United States, there have been 15 cases identified. Those have 13 of them have been in returning travelers, and 2 have been in close household contacts of those returning travelers who were known to be ill. So you know, the strategy in the U.S. has really been focused on containment. So as of right now, if we were to identify cases in Tennessee or in other places, then that person would be interviewed, and we would try to understand everything that they did, where they went, who they interacted with during the time period just before they became ill, and then once they became ill with symptoms. And then we would try to find those people that they interacted with, and we would watch them and see if they developed sickness, and keep them separated from the general public during that time period. So, you know, I think that's been the strategy, and I think that would be the strategy for the time being. And depending on the progression within the United States, if we saw more cases, then we could potentially control with a containment type of strategy. Then we would focus more on mitigation, trying to ensure that the sickest people receive care in hospitals, and that others just stay home and stay away, just like we recommend for the flu and many other common respiratory illnesses. You shouldn't go to the grocery store or work when you're sick, and that would be the goal if that transition happened. But for now, the focus has been identifying each case and trying to do what we call in public health contact tracing of all of their close contacts. Does that answer your question?
Actually good. How fast is the get a vaccine in this case?
I'll defer to Dr. Denison on that.
6 to 9 months.
And are we getting, let me know if there's any questions coming from Zoom.
Just a couple comments, and thank you for your really excellent questions and comments. I think a couple of things to think about the virus from a virus side is viruses are amoral, they're agnostic. They're not, some people don't even think of them as living entities. A simplest way to think about a virus is the virus that's here tomorrow is the one that was successful today. And it sounds so, it's sort of almost a philosophical construct in the sense that so the reason I say this is a couple things. One is that I think in terms of looking at this particular epidemic, SARS is informative in the sense of what was happening in, for example, in Toronto, which was really dramatically impacted during that time because of the outbreaks and the healthcare workers. And they were able to control it based on, like as I mentioned, the symptomatic transmission of disease. And they saw that when they did that and they isolated, home isolation, people were symptomatic or were contact tracing, that they saw a decline, and they thought, oh good, we're ready to go back to business. And they let off on those conditions, and it came back up again. Okay, so this is something that I think we don't know yet about this. I think everybody would like to think that this is just a trajectory. There's language used about it's going to turn seasonal, it's going to turn into just another flu. But this is a brand new virus that's never been in human beings before. There is no worldwide immunity to this virus. Okay. So I think that, in fact, the virus is doing an experiment in humans. And the natural history of it remains to be determined. We will look back and we'll have a lot of information on this. But I think in terms of a sense of preparation and with the sporadic outbreaks and the perfect virological experiment of trapping people on a cruise ship for 2 weeks under very stressful conditions with one air handling system with, it was a virus we're going to ask for some condition that was perfect for transmission, that would be it. So I think that there's things like this, and now popping up at small outbreaks in other places. I think the story isn't yet told. I'm hopeful that this will do a nice smooth trajectory in terms of and downward trend and disappear and go back into bats and disappear from the human population. That's one opportunity. Another is it will continue around the world slowly in little outbreaks because of asymptomatic disease. So I think that those are some things that we need to be. I would like to believe along with everybody, but I've watched these viruses enough and watching the SARS epidemic that I think the story will be over when it's over.
I'm Martha Boyd with the law firm of Baker Donaldson. Is this a virus that is impacting certain populations more than others, like the typical elderly, immunocompromised, people like that? And then the second question is, does the mask prevent the wearer from getting the virus from somewhere else or prevent them from spreading it to someone else?
Those are both excellent questions. One is, it looks like in general the mortality, so it's multiple diseases, and it's mostly in the elderly and those with pre-existing conditions, I think, in terms of severe disease and mortality, death associated with it. Maternal infant disease, there are now some pediatric cases and some pregnant women cases, and there appears to be no mortality or severe illness associated with that, so that's good news. So it's not like flu, which needs to be biphasic, very severe in young infants and very severe in the elderly, the typical flus that we're talking about. So that's one thing. And the other question is about masks. Masks are, it depends on the wearer, how they're worn. Surgical masks, viruses are very tiny. Surgical masks typically are good for blocking particles and droplets, which is how most viruses, probably this virus, are spread. Droplets, hand and nose. They definitely will keep you from touching your nose, which is a very good thing. N95 masks, which someone called respirators, those are the HEPA filtered ones you might get at Home Depot if you're working in a bad environment. Those are capable of blocking most small virus particles, as long as they're sealed and very well fitted around your mask. And healthcare workers, public health workers learn how to seal those. They have to do fit testing. So there's something they spray and you can't smell it, so it's good enough. But they are good at blocking. If I have a cold and I'm coughing and sneezing, they're good for that because they're going to block the particles that move around.
Follow on to that. NPR this morning reported about children and the mothers not seemingly having a major effect. Does every virus have its own MO? I mean, the next one or the one after that, could it have effect on children more differently?
The answer
is there a different story in each one?
The answer is yes. Every virus is like a dysfunctional family, dysfunctional in its own way. And I think that the point of this, that people want to put this in a category. They may want to make it flu, they want to make it SARS, they want to make it something else. But it's a new bat virus that's in humans, and that the trajectory yet has to be determined about how it's going to interact. Probably human coronaviruses that cause colds have been around for hundreds or thousands of years. We don't know what they look like when they first entered human populations before they established a kinder, gentler relationship that's just disruptive to my daily life, but not to the global economy or to the global environment.
I have one question myself. I was going to say, if you were going to imagine what's one thing that's going on that is on a paranoid action that people might be taking. On the other hand, what would be a foolish action that people would take?
Tell me what you're thinking of.
Like, there's something that people might do, you would say you ought not to do given the presence of the virus. What's one thing that people are like holding back from is like on the paranoid side that's not realistic, and they're sort of constraining themselves.
Well, I think Dr. Phil would agree that the risk in the United States right now is very low, very low. And in broadly, it's even low in China, right? I mean, if we think of the kinds of numbers and the percentages of people that are affected. So I think that standard precautions, I think foolishness is avoiding anything that has to do with any kind of ethnic profiling, anything related to businesses, anything related to something that's been shipped from China. Okay, they're not superpowers. They're not, this isn't science fiction. Okay, and although it's serious, they do have their limited lifespan where you have to determine how long it is, but it's not days and weeks. It's not in a container that's been shipped somewhere else that's going to survive for a long time. Those are foolish. It's very foolish to think that this has anything to do with any of, as I mentioned, socioeconomic status. Okay, they don't respect anything, and they certainly don't respect age. And I move into those categories. So I think that those are the kinds of things that you absolutely don't want to do. Those just worsen the conditions, because what those tend to do is drive people to not reporting issues. They're driving people to not reporting illness and symptoms, avoiding the kind of social contexts that are important to maintain our society in the setting of something like this. But that's definitely foolishness that I would. And the good thing you can do is straightforward things like normal good hygiene, hand washing especially, being aware of those kinds of things, prudent precautions. You know, help other people. If you're going to sneeze or cough, do it into your sleeve and not into the air around you. It won't be trivial, but I think these are really important things.
If the death rate is actually as low as being reported, I just have trouble understanding. To me, it seems like this is very easy to be caught or passed between humans. Is that accurate? I mean, it seems that way. If you're in the vicinity, it seems easy to catch. I guess I don't understand why, if the death rate is actually as low as being reported and it's mostly going to affect older people, or why has China shut down? Why is the world seemingly in panic? Or does that make sense?
Well, in retrospect, it will look that way. Okay. I mean, I think prospectively, I think this is, we've been very concerned about the reemergence of SARS and severe disease and rapid spread. This one has characteristics that are very concerning for a potential pandemic. The ability to spread with pre or asymptomatic disease, a range of severity of illness, multiple modes, a completely non-immune human population of the virus. This is the kind of scenario that gives all the modelers tremendous concern and pause. And I think the other option is what would have been the outcome if there had not been intervention, right? So if this had I think there was probably some period of time, whether you could treat China for it or not, in terms of openness of information, that there was enough of a diaspora of people and virus that allowed for the current situation that we're in. Whether that's critiqued or not, I think that's, people can look back and say, but I think what we can say is that it definitely was able to do that, whether it came out of a market or a point source from a single individual, that it had enough spread that it allowed for this to have this dramatic an outcome. And we don't know what this would look like in terms of mortality, morbidity, spread, worldwide disease, if there hadn't been the interventions. And you can't know that prospectively, and that's the problem with the new emerging zoonotic virus. And that's why I think it has had such a critical impact.
And I would just add to that, I think it's really difficult at this point in situations like this to assess things like the mortality rate, because we don't really know how many infections there are. Only people that are sick enough to seek healthcare are being tested, and so undoubtedly there are people that have subclinical or very mild infection that would test positive, but they aren't part of that denominator number to do that calculation. But that being said, I think in an immune naive population like we have around the world for this virus, even if only 5% of cases are severe and end up hospitalized, which is far less than what we're seeing in the numbers that we have at the moment. I think we also have to be concerned from a perspective of the strain on our healthcare systems. So a bad influenza season can really strain and stress the healthcare system in the United States. We saw that some this year. We saw it a couple of years ago when we had a really bad flu season. And so, even if it's not as seemingly scary as SARS might have been with a higher mortality rate or things like that, something that could spread very rapidly through the population and make a proportion of people very sick could put a lot of stress on the system that we don't necessarily have the ability to prepare for.
I guess a couple of things I say is if 1% of a billion is 10 million, right? These are kind of, we get lost in numbers, and I think there's also false dichotomies that have arisen around flu and SARS and flu in this virus. Right? I think people say, why aren't we more worried about flu? I said, well, we should be getting our vaccines. We should be doing the things we should be doing to not have flu. I think of flu as like seasonal flooding in a low-lying country. We know it's going to happen every year. We know it's going to be bad. We don't know how bad, and there's things we could do to mitigate that, but we don't do enough. Right? We never put enough resources because people forget, oh, it's just a flood. Right? And this is more like a hurricane. We're living in Hurricane Alley. It's a bad hurricane season. We don't know if it's going to be a F5 or an F1, right? And we can't predict that. We can't predict where it's going to hit, how bad it's going to be. And so you don't not prepare for either one of those, right? It's not one or the other. This is worse, this is better. They both have profound implications on human society, and that we have to prepare for.
Other questions? Yes.
Let
me come on over here and give you the mic.
First, from a medical perspective, there's a lot of concern in Geneva and New York about the amount of Chinese businessmen that are in Africa and Southeast Asia working on investment and infrastructure projects. And if something like this took off in a country, let's say Africa, that doesn't have control mechanisms, the research facilities to deal with it. And so from a medical perspective, when you talk about the WHO and some of the organizations, primarily Geneva, what would happen on a global scale if that took off? From a business perspective, the gentleman, I think that a couple of you import a lot, and if this has already been discussed, I apologize. What's happening on the demand on as you're looking to diversify? What's happening with your factories like in Vietnam and Malaysia as you try to take some of it out of China? Are they seeing too much demand? And thank you.
The movement outside. Can you hear it? Okay. The movement outside of China that has been going on for years, but really got reinforced back when the 301 tariffs hit, caused us all very rapidly to try and move goods into countries that hadn't made them before. There were certain categories, the apparel, easy to move, though the raw materials are, for most of it, still coming out of China. But other categories took a lot of investment and a lot of time to teach them how to do it, especially if it was specialized. So that movement's been slow. And it's also, if you want higher quality goods, usually the movement into a country is easiest at lower quality and gradually picks up as you get higher quality, but it takes years a lot of times to teach them how to make it or to get the investments done. So it's been, Vietnam's been pretty inundated, at least what I've seen, with the kind of products we're trying to get in most categories. And Mexico is more of a greenfield kind of arrangement. So it's been slower than we'd like to see. Reacting to this overnight, unless you already have it established in one of those countries for most products, is impossible. You may be able to shift a little bit, but most of it takes 6 months, a year, sometimes 2 or 3 years to get the right product developed in the right, and then you end up with the products back, the source of the supply for the raw materials is back somewhere in China even if it's a component or two. You may have 2 months of supply of raw materials, but you're still going to be a month or two late after that runs out because you're waiting on the factory in China to get back up and running and start shipping.
Just a reminder, we may still have Nick on the other line. I think he's still on there. So if there are any questions for Nicholas in China.
I think he was
I just wanted to kind of speak to, it's very easy to say to look at other markets and shift production, and it's just not easy to do. For us, we don't source, we own the manufacturing. So if you're talking about shutting down a factory and getting rid of 2,500 jobs and rebuilding a new factory or looking for new sources, right? We have our own facilities because it's musical instruments takes a high level of skill, right? And what do they say? It's always that's good, cheap, and fast. You can't have all three, right? You can have it good and cheap, you're not going to have it fast, right? Or you can have it fast and cheap, won't be good, right? So we're really focused on trying to develop, our products, and it's not so easy to be able to move, we've been there for a number of years, one of the first musical manufacturers privately owned in China. So it's difficult to find ways to work through some of these challenges, you know, but, you know, we're not oblivious to the fact that maybe we need to make sure that we're looking elsewhere for contingency plans accordingly. Because we do have factories in Taiwan, Germany, and other locations.
I'm happy to comment on that question. Yeah, so I think your point about, you know, countries around the world that might have less healthcare infrastructure or public health infrastructure to respond is certainly a concern. You know, after the Ebola outbreak in West Africa in 2014, there has been a huge push by the global community through things like the Global Health Security Agenda and other efforts to try to build capacity for surveillance and detection of either normal diseases that they see or novel diseases like this. You know, we've seen impressive response in the African continent just in the last couple of weeks, where they went from basically having one country that had diagnostic capacity for this assay to now, I think 10 to 15 countries have diagnostic capacity. So, you know, it's impossible to predict exactly what could happen if one of those nations, you know, had cases or had an outbreak there. But I do think it's important to note that this has been a focus by the World Health Organization and many other groups in the last, you know, 5 to 10 years. And I think events like this are all the more reason that we have to continue to invest in those efforts. You know, we speak a lot about building our own capacity and infrastructure in the United States, but, you know, diseases know no boundaries, and we're only as strong as our weakest partners' infrastructure in many ways. And so I think it's all the more reason that, you know, we hope that we can help build that capacity in countries around the world everywhere to help protect each other mutually.
This question is for Nick.
Let's just confirm that, hey, Nick, are you still on there? Let me make sure. I see you connected.
And part of it can be for our other panelists.
Oh, he's gone. He just went off. He was there a minute ago. All right.
Okay, I'll ask the other part and then go back to him when he gets back on. If you want to just leave that up there, then I can know when to start saying it for him. I'm interested in how this is impacting your all's employees in China, emotionally, you know, staying locked up in your house for weeks unending. How is that impacting them? And particularly for maybe workers on the lower end of the pay scale, are you losing them to delivery companies, for example, or are you doing anything to support them in this hard time? Are they still getting paid, for example? Any questions like that about how employees are dealing on the ground?
I can say one thing about the factories that I've talked to, that they're looking for a lot of local labor. I'm not sure how many of you know that after Chinese New Year, only 80 to 85% of the workers in the factory actually return. They get 13 months salary, and so after that time of their bonus, and that's the time of the year that they will switch jobs. So there's always a period of retraining. It's usually going to take probably 3 to 4 weeks for a factory to be able to get back to running 100% capacity after Chinese New Year. So what I'm hearing from a lot of our factories, and we don't own the factories, but what they're telling me is that they are calling up old workers, trying to find local workers because they can't get their workers back from Hubei and from inner China. So that's what I've heard. Jerry, I don't know if you know.
So our factories are not open yet. So we haven't had a lot of communication with the employees as of yet. You know, but I was going to mention the same thing as Henrie. You know, notoriously after the Chinese New Year, returning workers, you'll see a 15 to 20% drop off because that's the time that they're looking for new jobs. It may be even higher depending on what rates factories can reopen, because there will be a lot of people looking for work. And so we're trying to be as supportive as possible, and part of our reopen plan is indeed to be at full capacity as soon as we can, but with substantial overtime to meet the demand and the needs of the delayed production and so forth. So we haven't really communicated directly a lot with the workers because they're not in the factory. But the factory management is certainly looking to see how they can bring back, but they are concerned about how many will come back and how quickly can they be at full employment.
We thank God for WeChat, right?
Yeah.
I have a WeChat every morning about 4 o'clock with the people that work for us. We employ nobody in China. We have a group of about 50 people that only work for us, that act as agents for us. It's a symbiotic relationship. And they are going nuts, sitting in their house, in their apartment, for now going on 5 weeks. But they're handling it. And they seem to feel like this is worth it. They're monitoring. They talk about needing to get online every day and record their temperature, and the companies needing to get online every day and record where their workers are and how they're doing. And they all feel like it's the right thing to do. They're being very cautious. They struggle with how do you get more masks. We've got a puppy pad factory. We have 3 puppy pad factories. One of them was completely converted by the government to just a face mask factory. No more puppy pads, just face masks. So they're taking a lot of steps, and it may be overreaction, but I think most of them feel like it's very important and very supportive. The factories that are having the most trouble seem to be down south, because those are the ones that have the most travel coming in, besides in the Wuhan area. Most of the factories we deal with up north are mostly local workers. So they were able to start back, maybe not on the 30th like they wanted, but on the 3rd, the 10th, most of them. The rest came back last Monday. I mean, we still have some that are going to be out until the 3rd of March, 4th of March, but most of them are back, and they're getting pretty high response because they're local. And a lot of the shipments were prepared before Chinese New Year, or all the raw materials were there. So it's what happens after that, the cross-province transportation of raw materials or components is the hard part. If they can't cross, they can't get the components, even one small item that might only be 1% holds the whole production up. So that's starting to break. They're starting to break those barriers now in most of the big provinces. So that's a good thing. But yeah, they're all going a little bit stir crazy.
I'll add some humor. One of our factories, one of the reps told me that she was living a cat's life, eating and sleeping and laying on the bed. That's all that she's been doing. But to speak also to the emotional component, just from my friends in Wuhan, because so many of my very close friends I've had for 20 years are there. I mean, to be very honest, they're very broken right now. Just in Wuhan city, it's a very bad, a very sad situation. And if you can imagine being stuck inside for 27, 28 days. And I'm not sure if you guys know this, but even in Hangzhou, for example, in Shanghai, I think like once every 2 days, someone from your household could go out to get food. And so when you go out, you can't, I don't know about Shanghai, but for Hangzhou, you can't eat in the restaurant. So my friend showed me the McDonald's. You can go up to the McDonald's, there's a guard. You have to scan your QR code because I think it's Tencent or one of those companies has made sure everyone has their own QR code. Your temperature gets taken, it gets recorded so that the government's tracking it. Your food comes out to the table. The temperature of whoever prepared your food is actually attached to your food, and then you return home. So that's really the current situation. even in Zhejiang, like all over Zhejiang province, that's very far away from Hubei. So just to give you kind of an idea of the controls that are being put in place.
One more on the controls. In Shanghai, where I've had a lot of interaction, the controls that they have are, the biggest part is how cumbersome it is on what they have to fill out when they get back. They have to log in every day and put their temperature in and how they're doing. But if they go anywhere, it becomes a mass of forms to fill out. You have to go back to every place you've been, all the things you've done. So it's a lot easier not to go out until you're ready to do it all the way.
I think the issue of Africa versus or other places, I'm more worried about what would happen to our civil society if we had this kind of outbreak because of the nature of how we respond. I think there is a corporate, this is an independence and individualism versus sort of a societal all in it together. I don't want to make too broad generalizations, but I think that would be, we have great public health and great institutions. I think that's something that we would have to consider. I think the issue of other countries this came up with SARS this was the great fear that you got into an area where there was really less public health management, wherever that might be, and it didn't happen, and we don't know why it didn't happen. And I think that's a really interesting question that I hope doesn't get explored this time. But I think we don't actually know why it didn't with SARS, and so far why it hasn't with this virus.
Is that a fear with Iran? Because I watched that, it was no cases, all of a sudden there's 2 deaths. Then it's 3 cases, 2 deaths out. It's like, you're not getting the news there. Is that it?
I mean, I think that the geopolitical situation in Iran is very complex right now. So, I mean, it's hard to speak to exactly what might be happening. But I think there's no there's no country that's immune to some of the challenges that we could see with this disease. And I'm not an expert on Iran, so I can't delve into that too specifically. But I do think, just given some of the current instability with recent political events that have happened there, is it a concern just about trust in government, and it's a very different scenario than what we see in China and other places.
Well, I'd like to raise one issue related to that, which is the trust in government. This is a delicate issue, but when we talk about risk, there's supply risks, there's market risks, we also talk about political risk, right? That's one of the standard ways you analyze market entry into the country, how stable will things be, and of course China has been very stable, but with certain trajectories that are dismay some people and may be helpful in other ways. And so there's this debate about whether the response currently is either an expression of the advantages of the system that currently exists in China, or is revealing the gaps. And so some news reports have talked about civil society not working. So kind of things like Red Cross, the centralized control system to allocate masks is not working. Whereas civil society would be how a lot of volunteers and groups would be doing it. And you can hear about the emotions. So the emotions go a whole lot of ways. And so as you watch that, I guess a lot of people deal with China, so you don't want to say too much. But there is a question of whether this will be either a validation of the system or showing a reason for people to be angry at their circumstances.
Yeah, I will just say, I think the lockdowns and quarantine measures and things that we've seen put in place in China are fairly unprecedented at the scale at which they're occurring. And I think only time will tell how that story tells itself and how this unfolds. I do think, however, from folks that are experts in public health ethics and law and things like that, there are often concerns that it's the most vulnerable in societies that are affected the most by measures like that. And so, you know, again, I don't have a crystal ball, and I don't have friends that live there, and so I can't speak to specifics, but I do know that some of my colleagues in those arenas are worried about the more impressive impact perhaps on the people that would be most affected and the most vulnerable in those communities and populations. And so I think we'll just have to see on the back end of all this exactly what happened.
Since I lived there for such a long time, I think I can speak to this a little bit, but I do want to be careful because this is being recorded. So find me afterward. I also, I love China, so, you know, that's the first thing I want to say, and it is my second country. I think it is, to your point, a very interesting time with what is going on there. There's a lot of things in play with politics. There are a lot of emotions running wild in China right now. If you have WeChat, you understand that it went a little bit quiet in the last 2 weeks. So you can just kind of take away that, what you will. But it is, I think it's going, the next 6 months are going to be very, very interesting to see. And that's all I want to say.
I was thinking about a letter that I received today from FedEx, because we deal with different supply chain partners, and they raised the point that if you want to ship anything to China right now, if you want air in, there are surcharges that go with that. And I'm thinking, okay, I kind of expected that. But then there was a small little article, a little paragraph there that talked about, we are reserving space in our planes for humanitarian aid. And so I kind of got the letter, and so I reached out to my rep, and she explained, I can't say this out loud, but it's kind of the price of doing business in China. And so the implication there is that for FedEx and other companies to be able to operate there, they had to make some agreements in place to be able to continue to operate there. And to me, that signals that China's saying that this is kind of a little bit long term, that they know that they're going to need continuous aid coming into the country, to the point that they're telling people shipping, you know, UPS and FedEx, they all have their own planes that ship over there right now. And those seem like the only ones that can really get product over there right now. If you need to ship a sample or anything over there, they're saying you got to reserve space for products for supplies that we need. That was pretty loud and clear to me. That was made to me today.
Very interesting. And I know that there was some talk about how the U.S. was the only country that, when they were sending planes in to evacuate citizens, other countries doing that did bring plane loads of supplies into China with that empty plane, and the U.S. was the only country not doing that. So that I'm sure was well noted.
Related to donations, we're trying to collect information on any companies who are making donations to China for this crisis, whether it's financial donations or donations of masks or other kind of medical supplies. So if your company has made a donation to any kind of nonprofit or government entity in China, please let me know afterwards. That would be great. Thanks.
Yes. Oh, I want to kind of go back to the consumer-facing question from earlier. And being in the social media patient world that we're in today, where nobody gets excited about anything, what happens when the reality starts hitting people in the U.S. or wherever that I can't go to the store and get X? And how do you as a business monitor that trend? How do you prepare for that trend? How do you be proactive? And how do you identify opportunities where your competitor may not be able to fill a space where you might be able to move into that space?
Well, we're looking at it as, you know, trying to contact our key retail partners and making sure that we let them know that, hey, this is available inventory, all the things that you buy. You may want to load in a safety stock to carry you through this until we can increase the logistics and the supply chain. But we're also very prepared to be able to offer things through our dealer network, which is our conduit to the consumer, to offer things that are like models, maybe not made in our China. So maybe they're made in Taiwan, maybe they're more expensive, but we offer it an equitable price so that we can try to sustain as long as we can. Depending on how long the delays and the factory shutdowns or whatever it may be, at some point in time, it may have to be a conversation with consumers, trying to get them to understand. The problem is the consumer, we're in an instant gratification world. They're not necessarily going to wait for your product. They will just go find it elsewhere. And those are things that we're going to have to deal with as they come along. And we're prepared to do some pretty drastic things to try to mitigate that until it gets to the point that we can't.
Yeah, I would, not too different for us. We have a percentage of our products that are made exactly like we want them by my group, design, develop. So of course those are the best, right? And some of those will be in short supply for a short time. We've done everything we could to understand what that will be, when it will be, and made sure we had alternatives for them available. There's lots of ways to spike or limit the demand. So you've got that, but for us, our core for our customer is, we're committed to be the most dependable supplier. So we already try and make sure we have plenty of backstock. We have plenty of places to be able to get the product, especially on the core things that they get. And for us, luckily, most of the core products, what we call Q items, consumable, usable, edible, are things that they get domestically. They have to have their feed for their animals. Well, we make sure we have the feed for the animals. They have to have their dog food. They have to have their cat food. They have those Q items. We don't have any fear of running out of stock. We'll be in stock. The other things are, they're farmers and ranchers. They're very flexible and they really understand. They'll make their own if they have to. So I think we've got, I think we're in pretty good stead in that case.
I think it's a good question, to be perfectly honest, because I don't know. It depends on how long this thing's going to last and how long production is kind of stopped in all essence right now in China. If this thing prolongs, I think there's going to be a deep impact overall. I've been talking to some of my friends that work for major retailers and that sort of thing, and the warning signs, they've already given me the warning signs, just as a friend kind of thing. To the essence of some of the national brands have told them, you can expect anywhere from 50 to 70% of what you already ordered coming into this holiday season. He basically told me, hey, if you see a toy that you want to give your kid for Christmas, go ahead and buy it. I think one of the things that I think some of the retailers are looking at is how they're going to run the promotional aspects of them, because they'll be very heavy promotional for times, that sort of thing. But you might see them be less promotional in the time to hold on to inventory. Just because and I think this is going to be one of the first times that, depending on how long this lasts, that retailers are going to have more open to buy dollars to spend than they actually are going to have product. And that's a weird concept to be in, going into this time of the year. And that's very different. But I think, not to paint, gloom and doom on this thing, but if this thing goes another month where we're seeing where we are now, I think it will have some long-lasting effects all the way up into around January. That she has that from the inventory standpoint.
So we're going to see prices going up?
I don't know if you're going to see prices going up. I just think how some retailers, especially some of the mass discounters, I think they're just going to be less promotional, because you can control that, right? You can't control what's coming out of the country. If they're telling you you're only going to get 50% or 60% of that part they can't control. I think what they can control is in terms of, okay, I can't jack up my prices without my competitor jacking up the prices, and that would be a violation of federal law, so they're not going to do that, right? So what they're going to do is say, I'm just not going to discount the item to a certain extent. You just gonna see them being less promotional to hold on to inventory for a little bit longer. That's what they can control. That's just my thought. It's me right here.
What you got there?
Oh, great question, by the way. On top of kind of what you said, this is the breakout in Western country where everybody's telling people on social media that they're safe away. One really good place to watch is the Department of Interior and Department of Agriculture are really looking into this as we go into 6 months. And Ken's company will probably get really busy with people going into survivalist mode, chickens and going back to the farm kind of thing. I should tell you. But if that happens, we should really look into the Department of Interior and Department of Agriculture's releases and things where they're updating Congress on C-SPAN, because they're really looking into this majorly if people go into that kind of behavior.
And we would recommend it. Chickens, right?
Chickens in backyard.
Backyard chicken.
I have a sort of question because we've been working for the last, a lot of people have paying attention to MERS. MERS still has a 35% mortality. In Saudi Arabia, and it's typically associated with interactions with cannibals or other things, or some limited direct transmission. It's only been about 3,000 cases in about 8 years, but still the new cases, it's still about a 35% mortality. So I think there's these, these issues of this, what's going on, and now we've had SARS in 2003, the MERS in 2012 to now, and now this virus, with the demonstration by some of my colleagues that there's multiple bad viruses that are already capable of infecting human cells. So this isn't something that's new. And I guess my question is not, I don't, maybe we shouldn't end on this. Is the issue, I guess it's the issue of resilience. Everybody wants this to be over, right, and to get back to normalcy. And I think of this kind of like maybe a 10,000 year flood, right? That doesn't mean it's going to happen once every 10,000 years. That means you have a 1 in 10,000 chance of it happening every year. That's what that means. And so the question is as you get through this, are there going to be any lessons that you could take away, with the understanding it might not happen again for 50 years, right? Or it could happen again in 3 years or 5 years, or it looks like at least maybe every 7. But that's random. That's just random. But it suggests the possibility that this virus family is capable of doing this again, right? And so, is there any thought about, will that be part of people thinking about what do you do about catastrophic or potentially pandemic pathogens that can enter into the population? Is it even something that can be taken into account of the business model? I have zero idea. I just wonder.
I know from our end, there's lots of discussions for the first time that I've heard from companies about what is your strategy, which usually means there becomes a strategy. It's funny, you start thinking about all the things we're supposed to do to minimize flu and colds. It's the same sort of thing. We passed out, as soon as we heard about this, we ordered online, and it still took 3 weeks to get masks, but we got Perel, we got all the wipes, the gloves, and made little kits for everybody if they were traveling. You can wipe down the plane, you can protect yourself, right? And talked about, look, if you think you're sick, stay home. I mean, just reinforcing things that grandma would have told you anyway, right? So I think we are going to see what's next. China +1 has been a strategy discussion for, 15, 20 years. Nobody wants to have all their eggs in one basket. We certainly were happy where we had done it and sad where we didn't. When Trump decided we had 301 tariffs, so all of it's always a balance. We always sourced everywhere, but you placed it all in China because it was the best place to buy it. It was the best quality for your customer, the best logistics system. It was the best. But now you start to say, okay, I will pay a little bit more and make sure I have another country. So I do think we're going to see, from a global sourcing, life has changed a lot.
I'm going to wrap up. We're getting close to the end. I'll make one observation myself, which is what we're getting at the end is sort of what are the risks? What are the things that can happen and how it can extrapolate? So, related to the epidemiology of this, New York Times had a great kind of model that you could click on, which said if the transition rate was 1 point, each person sick creates 1.3 other sick people versus 1.5. I mean, that tiny difference. If you extrapolate that out, it makes an enormous difference of whether you end up with 500 people sick or 30 people sick at the end of a month. That may not be exactly right, but small differences have enormous differences in impact. And in business, the same thing seems to be true. We're down to the point where we've gone through the surplus range, and we're at the point where something as small as a week or 2 or 3, not 3 months, can have implications about our Christmas season. So we're seeing the same thing with small variation on the margin of what we're dealing with can have enormous impact. I'd like to just wrap up and say to all our guests, thank you very, very much for this informative, intimate, and compelling discussion of a global problem. Did you want to end with something here?
You all could please fill out your surveys on the table. It's really helpful for us. Also, the recording of this we're going to be putting on YouTube. So if you have colleagues that want to watch it, next week I'll be sending out a newsletter with the link. So if you aren't on our e-newsletter yet, you can check the box that says add me to the e-newsletter as you walk out on our registration sheet. And also, we'd love to have you all join the Tennessee China Network members. There's several of you here that already are. And I'd also like to introduce our board member, Frank Strait, over here from Sacred Donaldson. Thank you for coming. That's it for me. So thank you, everybody. We really appreciate it. I hope you learned a lot. And our panel, thank you so much. And thank you to our sponsor, Implement Now, and to Vanderbilt Owen Graduate School of Business for hosting us.
Mark, thank you so much.
What do you want to say?